Bismillah, alhamdulillah, salatu wassalamu ala Rasulullah. So, another day we were talking about continuity of care and comprehensive care. Continuity of care is when some child has chronic problem. So make sure the child goes through treatment and rehabilitation until the child is cured. Similarly, comprehensive care is when a patient has many problems, and it's the primary doctor's responsibility to make sure that all aspects of his problem are taken care of. Like in autism, child needs the speech therapy and physiotherapy and occupational therapy and different occupational skill and communication. So it's the doctor's responsibility to make sure that child gets everything. One other aspect is that there are some community resources. For example, in Pakistan, there are certain organizations who work for patients. Like there is Sundus Foundation who take care of thalassemia kids. Similarly, there are many other disease patients taken care of. So if we had those resources at hand, we make pamphlets and the doctor keeps it. So when the patient comes in and I know that this company is doing something for that child, I will refer them to that place. Similarly, so that child can get comprehensive or enough resources where he can get better. All right. So today, I'll give you an example. A lady came to my clinic and she had a 6-year-old child and a 2-year-old child. So the 2-year-old had problem that he's using formula, so they changed the formula. After that, child started having loose motions, so mom don't like that. And the 6-year-old child has problem that her nose is blocked because there are polyps. She has difficulty in breathing because her tonsils are big, and most probably child has adenoids, and most probably child may have apnea problems or sleep difficulties or sleep apnea. So you can imagine a mom bringing those child. So who she think is serious or problematic? So she thinks that 2-year-old should not have loose motion, So just doctor, can you take care to make sure that she doesn't have loose motion? So as a doctor, I know that all the child needs is ORS. So if we gave the child regular ORS, there is no dehydration, the child is good to go. But the 6 years old, where she said, oh, it's a chronic problem, I don't care, it'll get better. So now I have to tell her. So what did I tell her? I said, if the child's nose is blocked, he had to open his mouth. When mouth is open, breathing happens, the hard palate goes up and makes the changes in the face. It can cause with a deviation of nasal septum in the middle of the nose. Now when there is obstruction in the tonsils, so when child is sleeping, those tonsils fall back into the throat and they block the trachea to take the breath in. So child comes out of that state very irritable. So goes into sleep, his breathing is difficult, comes out, goes in, comes out. When child wakes up, is very irritable. So when he goes to school, he cannot concentrate and he's sleeping on and off. All right. So if this problem exists for a long time, child can have sleep apnea. So what happens is that child can stop breathing for 20 seconds or more. So this can have secondary consequences. What secondary consequences? That it can cause arrhythmias and sometimes sudden death and cause a problem with growth and development. What else? If the child is not breathing enough, there will be failure to thrive. There can be malnutrition. There can be problem with the intelligence. So you can see, a mom can never ever know so many things about a thing which she don't think is a problem. So who is responsible for all of it? We doctors are responsible. If we are not having comprehensive care and make sure the child goes through that state continuously, doctors are responsible for that. Many doctors I've seen, they are concerned about their own problem, one problem. They are not worried what the child is doing. That's where we need primary healthcare person, and it can be anybody, like from LHV to general pediatrician, frequently specialist even. So continuity of care and comprehensive care needs a continuous work from birth up till like 25, 30 years of age. So who will take care of those responsibilities? If we don't take care of responsibility of the problems, there will be additional burden on the health budget of the countries which are already struggling. So please, to the parents, try to educate yourself. Try to have a doctor who sees the child, not from his own specialty, but makes sure that whatever the problem they have, that's being taken care of. So if patient has problem with his speech, I refer the child to speech therapy. Then I call him back and ask whether you have been taking care of the speech therapy. If the child has some difficulty, I make sure they go to the concerned department and get treated. In United States, where I have been, I have seen that the primary care doctor used to have scheduled rounds for the patient to come in. And sometimes, mothers, they forget, or they're busy, or they're negligent. This child is not brought to the office, so they are called. We have been calling patients sitting in the clinic and make sure the child comes in. So if they don't come 3 times, 4 times, sometimes we may have to involve other services like child protective services to make sure the child is not abused, is not neglected. So let's start and put the foot right direction. In our primary health care, we're supposed to teach the patients. And one thing I usually say is that if common public don't know their health issues, it's the fault of the doctor or the concerned authorities who are supervising them. If the common public don't know the basics of law abiding, is the responsibility or fault of lawyers or concerned department. If society don't know how to manage finances, it's the problem with the budget people. So on and on and on. So let's take our responsibility, make sure that person come in, we don't treat the disease, we treat a human being. Inshallah, we'll go further from here and we'll make sure that our quality of life is improved with the passage of time. Thank you.